Hello, it's Nosmo from Rophem NCLEX Academy. Let's answer some NCLEX practice questions on liver cirrhosis. Question 1. A client was admitted with a diagnosis of liver cirrhosis. Which laboratory values are expected in this patient? Select all that apply. Answer choice A, elevated ammonia. B, decreased albumin. C, increased hemoglobin. D, decreased ammonia. E, elevated PT-INR. Which of them are your choices? The correct answers are A, B, and E. Let's break it down. The liver synthesizes albumin. When the liver is not well, it will not be able to carry out its functions as it's supposed to. So, in patients with cirrhosis, lab testing may show elevated ammonia level, a low albumin level, and elevated PT-INR. Answer choice C is not correct because hemoglobin levels are usually low due to factors like GI bleeding. Answer choice D is not correct also because in cirrhosis, the liver cannot use ammonia properly, which means ammonia can build up to high levels in the blood. Question 2. A 40-year-old client diagnosed with cirrhosis has developed ascites. What is the primary cause of ascites in this patient? Answer choice A, increased cardiac output. B, portal hypertension. C, decreased parathyroid production. D, increased ADH secretion. Which one is your choice? The correct answer is B, portal hypertension. And here's the reason why. In patients with liver damage, portal hypertension happens when there is persistent increased pressure in the portal vein. Portal hypertension can lead to forceful leakage of too much fluid into the peritoneal cavity, which is ascites. The other answers are not correct. Next question. Which of the following findings from a patient with cirrhosis indicate hepatic encephalopathy? Answer choice A, jaundice. B, dark urine. C, pruritus. D, hysterexis. Which of them is your choice? Correct answer is D, hysterexis. This is the reason liver dysfunction can lead to a buildup of toxins like ammonia. Hysterexis, also known as flapping tremor, is a classic sign of elevated ammonia and hepatic encephalopathy. Jaundice, dark urine, and pruritus are all due to the inability of the liver to metabolize bilirubin. Next question. Which medication is used to lower ammonia levels? A, spironolactone. B, lactulose. C, furosemide. D, propranolol. Which one will you select? Correct answer is B, lactulose, because lactulose traps ammonia in the gut and promotes excretion via stool. Spironolactone and furosemide are diuretics. Propranolol is a beta blocker. These three medications are not used to lower ammonia. Next question. Which lab result places a client with cirrhosis at highest risk for bleeding? A, elevated ammonia. B, elevated bilirubin. C, prolonged INR. D, low sodium. Which one is your choice? The correct answer is C, prolonged INR. Here is why. The liver produces clotting factors. INR increases in liver disease because the liver is unable to produce adequate amount of important clotting factors. Therefore, blood clotting slows down. A prolonged INR means their blood will take much longer time to clot. Bleeding risk is very high. Next question. A nurse expects to see which of the following stool changes in a client with cirrhosis who is taking lactulose. A, constipation. B, hard stools. C, frequent loose stools. D, black tarry stools. Which one do you think is correct? The correct answer is C, frequent loose stools. And here's the reason. Lactulose traps ammonia in the gut by drawing it from the blood. This way, it can be flushed out of the body via stool. The expected effect is frequent loose stools. Constipation, hard stools, and black tarry stools are not expected effect of lactulose. Next question. A client with liver cirrhosis has developed esophageal varices. Which intervention is priority for this client? Answer choice A, encourage coughing. B, administer stool softeners. C, insert NG tube. D, give IM injections. What do you think about this one? Correct answer is B, administer stool softener. And this is the rationale. Straining increases portal pressure, and that can cause varicose rupture, which will lead to bleeding, and that may be excessive bleeding, which we don't want. Patients with esophageal varices should not be encouraged to cough. No NG tube. Both of these can increase the risk of rupture. IM injections are not advised because patients with liver cirrhosis have a high risk of bleeding. Next question. In a patient with cirrhosis of the liver who has portal hypertension, which of the following signs suggest the portal hypertension is getting worse? A. Hypoglycemia. B. Ascites. C. Dark urine. D. Weight loss. Which of them is your choice? The correct answer is B, ascites. Liver failure causes ascites. That's fluid in the belly. This is due to portal hypertension where blood flow is blocked by liver damage. The result of this is pressure increase in the portal vein, which will force fluid out, leading to ascites. Next question. Which diet instruction is most appropriate for a client with cirrhosis and ascites? A. High-fat diet. B. High-protein diet. C. Low-sodium diet. D. Fluid-only diet. What do you think about this one? The correct answer is C. Low-sodium diet. Do you know why? Sodium restriction reduces fluid retention and ascites because sodium causes the body to retain extra fluid. That will make ascites worse. So a low-sodium diet is appropriate. Next question. A client with cirrhosis becomes confused and disoriented. What is the priority nursing action? A. Apply restraints. B. Check ammonia level. C. Ensure patient safety. D. Administer sedatives. Which one is your choice? The correct answer is C. Ensure patient safety. Rationale is this. Safety is the priority when you have patients with altered mental status. To apply restraint when the client is confused and disoriented is not the right nursing action. Answer choices B and D are also not correct. Thanks for watching and learning from this video. If you want a more NGN-focused NCLEX prep, our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that is built just for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like, comment, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.